In this program, we're going to look at the layers that form the wall of the gastrointestinal tract, and it will end with looking at the nerve plexus within. If we remove the initial covering of visceral peritoneum and adventitia, we'll see that there's an outer longitudinal layer of smooth muscle around an inner circular layer of smooth muscle, and when we remove the submucosa, we're left with the mucosa within. Now, as we look and put on the various parts again, we'll see that between the inner circular and outer circular longitudinal muscle, there is a network of nerves, and these are preganglionic parasympathetic fibers synapsing onto the cell bodies of parasympathetic neurons. Now, as we continue to put on the various layers of adventitia, we find that there are blood vessels within the adventitia itself, and here we're looking through the adventitia and seeing the blood vessels course through it. And finally, as we cover it with the visceral peritoneum, when it goes on to the body wall, then we will call that as parietal peritoneum. Now that we've gone through all of it, let's go back to what we're interested in. And here we're looking at the ganglia between the inner circular and outer longitudinal muscles. And here we see that fibers from the vagus nerve, they're preganglionic and parasympathetic, and they're synapsing onto cell bodies that belong to the postganglionic or postsynaptic parasympathetic axons. And in our next section, what we'll do is just look at a histological section of what we've just seen through. And again, what we now see is a cross section through the esophagus. The lumen is in the center, and there are 4 layers that we saw earlier drawn. Here, these are the histological sections. First, there is the layer of mucosa, surrounded by the layer of submucosa. Then there's the muscularis externa layer with inner circular and outer longitudinal muscles, and finally connective tissue known as serosa or adventitia. Now, what we've drawn in here is within that muscularis externa, between the 2 layers of inner circular and outer longitudinal muscle, those oval shapes represent the parasympathetic ganglia, and on each side of the esophagus there's the right and left vagus nerve, and we're just seeing that there are nerve fibers from there going to these parasympathetic ganglia in the myenteric plexus. Now, within the submucosa, there's also a submucosal plexus, also a parasympathetic plexus, but for our purposes, we will use the myenteric plexus between the inner and outer longitudinal muscles to study more and increase our idea of the parasympathetic nerves that go. And here we see that there are postganglionic parasympathetic nerves supplying both the inner and outer longitudinal muscles.